Hi, I'm Dr. Jeff Jenkins, Upright Chiropractic. In my clinic, we do rehab, helping people recover from injuries after car accidents, slips and falls, sitting in poor postures. One of the things that we do, like in a ballistic macro trauma, like a car accident, when bones get out of alignment, they often affect the soft tissues of the body, and we need to rehabilitate those soft tissues to be healthy. So this is how the body is put together and how it works. If we have two bones together, and all right, that these are bones, so you know they're bones. Okay, wherever we have two bones come together, there's a structure that connects them called ligaments. Ligaments connect bone to bone. So these are ligaments. Ligaments connect bone to bone. Now, ligaments connecting two bones, good and healthy, all is good. When we have a macro trauma, it can tear the ligaments. And if it tears them, there's three grades of it. It can tear just a few, up to 10% grade 1, or most grade 2, or pop, all three. But when when the ligaments get overstretched or torn, then it's not connecting to two bones, and so the body lays down fibroblasts to try to reconnect these two bones. But when the fibroblasts come in, it's a crisis situation, like Arnold in the movie Twins. You act too fast in a crisis situation. In a crisis situation, this is called scar tissue. That's scar tissue that gets formed. And the scar tissue has, some of the fibers are in the correct direction, like the ligaments were, which will allow normal function. But others are cross fiber now, because it's a crisis situation. So the scar tissue gets formed in different ways. And what that does is inhibits the movement of the joint. Okay, if the elbow has certain movement, flexion and extension, it's a hinge joint. Now, the ligaments are running unilateral, this way. If it gets torn, then scar tissue comes in. Some of the scar tissue is formed this way, but some is adverse to that way. So it restricts movement, and now the body doesn't move so well. What we need to do is deal with that scar tissue, and the sooner we can do that before it gets a big hold on the body, the better chance we have to get healthy. Now, scar tissue has three parts to it, three things that make it different than the original tissue. Number one, scar tissue is weaker than the original tissue. It's weaker forever. The red fibers are not going to be as strong as the original blue fibers were. It's easy to injure, like a sprained ankle. I'd say whoever sprained an ankle, many people go, I can sprain my ankle, doc, and they'll just move their foot and sprain it again. Because once you injure a part of your body, it's always more susceptible to re-injury. So if you keep tearing those ligaments, then it gets weaker and weaker, okay? Number two, it's less elastic. Scar tissue is less elastic than normal tissue, meaning it's bound in different ways. Number three, it's more highly innervated. There's more nerve fibers there now, more nerves. So it's very sensitive. So if you've injured a part of your body in the soft tissue, it's weaker, less elastic, and more highly innervated. So it's a little sensitive than the original tissue. So what we want to do in rehabilitating the body is break down the cross fibers. Okay, so we do stretching, traction, trigger point release work, and I show people how to move in ways to encourage the proper fibers, break down the cross fibers so that the body can come back to its normal function in the best ways possible. So it's really important to rehab soft tissue after an accident, a slip and fall, or a sports injury, or some kind of macro trauma. Okay, one thing's different with bones. When patients come in and they hurt a bone, they say, I think I need an x-ray, doc. I think I broke my finger or my arm or whatever it is. What happens with bone, when you break bone, osteoblasts come in, lay down more bone. And it heals. That place that you broke now has more bone and is stronger than the other bone. So when we break bones, it can get stronger. With soft tissue, that doesn't happen. It gets weaker. So we want to make sure we rehab the body properly. And at Upright Chiropractic, we want to help you get upright to break the gravitational hold on the body that pulls the body into flexion, looking down. If you learn nothing else from me, this is what I want you to get. Chin up. How far up, Dr. J? As far as we can get it from our chest. How often, Dr. J? Every breath till we reach 100. I said after 100, do what the heck you want. But we want to get into this position to be healthier. Every time we look down, it's more exhausting and supports the body in an unhealthy way. Every time we look upright, it's more beneficial to the body. And as long as we're looking up, we might as well just ask, what am I most grateful for right now? And you really want to get healthy? That's the question. The more often we ask that question, the happier, healthier we'll be. So welcome. I would love to take a look at you. If you have any symptoms, any problems in your body, headaches, neck pain, back pain, sciatica, those types of things, I can help you recover from them. More importantly, I can teach you how to take care of it every day till you reach 100. Come see me at Upright Chiropractic.